Okay, it's now letting me record. So we can go ahead and start.
We have to wait for Dr. Frona to tell all of us to start, or?
Gotcha.
Oh, I was
He
wondering.
sent a message saying we could start.
Okay. All right, so are you recording, Ted?
Yep, sure am.
Wonderful. All right, everyone, welcome. Thank you for joining us on this Friday night. Welcome to room 6. We have 5 programs here for you. And I'll give you the opportunity to introduce yourselves. I'm going to call out the program name, and then whoever the program director is or whoever's representing the program can give a brief hello, and then we'll go through each of the infographics that you guys have put through, and you'll get about 5 to 6 minutes. As a reminder, when the 5 to 6 minute time mark has come up, a blank slide will come through, and then you know that that's your time to transition to the new, to a different program. So without further ado, we have the Joe and Teresa Lozano Long School of Medicine at UT Health San Antonio, represented by Dr. Arandes.
Hi guys, Dr. Arandes, and my residents who are in the room with me, Tab Rabani and Asha Thomas. Do you want me to go ahead with the 5-minute slides?
I was gonna go introduce everybody first,
Okay.
But yeah, and then our second one is from the Morehouse School of Medicine here in Atlanta, Dr. Lynn Gardner.
Good evening, everybody. Lynn Gardner, as introduced, from Morehouse in Atlanta. And here with me tonight is one of our awesome interns, Dr. Brianna Ferris. Dr. Ferris, thank you very much, ma'am, for being willing to hang out with me this evening when you could be doing something else. So I appreciate your commitment to the program and to the applicants this evening. So nice to meet everybody virtually.
And then hailing from the state of Florida, the University of Florida, Jacksonville, Florida, Pediatric Residency Program, Dr. Mirza.
Good evening, everyone. Nice to see all of you virtually. So I'm here today with 2 of my awesome residents, Brett Murray, who is a 3rd year and also one of our chiefs, so he's awfully busy. And Carla, she is a peds neuro resident, which means that she does 2 years with us. She's an intern, so she's been with us just a couple of months. And then she's going to go on to do peds neurology training at Untitled Chapter.
Wonderful, thank you. And then from Charleston, the Medical University of South Carolina, we have Dr. David Mills.
Hey guys, nice to meet you. I'm Dave. So yeah, weird times we're living in. You know, it's actually really cool that we've got 49 people in just this small room together. So I've expanded my screen the best I can to see all the smiling faces that are out there, which includes 2 of my awesome residents. I've got one of my 2nd year residents, Charlene Chalmers, excuse me. Charlene, give us a wave. All right. And I've got one of my interns, Zig Laney. Zig. All right. We are really excited to be here and share as much as we can about our program in a short period of time. Thanks, guys.
Wonderful. And then lastly, we have Emory Pediatrics Residency Training Program with my program director, Dr. Susie Buchter.
Hi, everybody. We have lots of folks here from Emory to talk to you tonight. 2 of the associate program directors, Dr. Rebecca Sanders and Dr. David Wolf. My 2 chief residents, Brianna Glover, Leon Betterman, and as well as Amelia is Demira Tambunan, who is one of our child neurology 2nd year residents.
All right, without further ado, I think we can go ahead and start with the infographics.
Sorry, trying to remember to mute and unmute. Thank you guys for joining us in this room or being assigned to this room. I think you're quite lucky. Obviously, we're each going to have a chance to review these, and I know they're going to be recorded. What you heard in the overview of the Southwest or Southeast and Southwest regions was really quite accurate. I think you'll find for almost every program that you'll review. You've chosen a wonderful field, and as a result, you're going to face a difficult decision in how to discern between all the fantastic programs and wonderful program directors you're going to meet. But our program in San Antonio, as mentioned, we are one of the 3 most populous cities in San Antonio, but we are unique amongst those 3 as being the very large town that actually behaves much like a small town. And so one of the really important strengths of San Antonio that is hard to capture on an infographic is really just the community of people. And that is everyone from the very unique patient population to the residents that join us for a variety of reasons, and the faculty that I work with every day. So really, again, as the program director, I have the benefit of really just bringing together all of those pieces. We are a general pediatrics program, a medium-sized program that has always focused on community health, and as a very integrated partner with our county hospital system, University Hospital, we have the unique opportunity to care for patients in a setting where, you know, truly all of us have been drawn to pediatrics to provide that care. But additionally, it's also one of the major catchment areas for a very large portion of Texas that provides care for underserved patients all the way down to the border and beyond. And we have the single largest pediatric trauma and burn center for that catchment area. So we, in addition to our general pediatric population, our very robust subspecialty services, we get really wonderful exposure, and have always been very proud to say that our graduates are infinitely prepared for general pediatrics and pretty much every area that follows. As a medium-sized program, we do have some fluctuation from year to year, but we average about 35 to 45% of our graduates going into fellowship. And despite being what I say, not a fellowship-driven program, we do have a number of smaller fellowships ourselves in neonatal critical care, pediatric intensive care, hematology, oncology, endocrinology, child abuse pediatrics, and then also a hospice and palliative care program, as well as some other opportunities. Nonetheless, our fellowship-bound folks do very well matching into very competitive fields across the country. And we have a substantial number of folks who stay in the region as well. So we're really quite proud of our products and happy to say that we keep in touch with them and they keep in touch with us as well. You'll find most of us will talk about our education focus. Certainly, I think one of the biggest strengths, again, is relationships. Our residents and our faculty develop very strong ties beginning early in their intern year, and those really build through their training. That is formal mentorship, that is on-the-job teaching, that is in the trenches learning, and some, you know, cutting loose and getting to know each other. And I think one of the things that's most fun about what we do in pediatrics is how we're able to model, you know, our practice, because it really brings out the best in us. We also really believe in interprofessional collaboration. So one of the really big emphasis for us is how we prepare our trainees to work as a member of a team, because pediatrics is for sure a team sport, no matter where you're practicing and what field you're practicing in. And we really do like to ensure that we're, you know, the most responsive, responsible, and communicative members of those teams, sometimes in a leadership role and sometimes in a supportive role. But I think, you know, our residents are wonderful collaborative partners for all of our teams. And I think beyond that, you know, we really do want to make sure that we are happy as a family. Our department has a very family-oriented culture. And as a result, we really do focus on sort of work-life integration and really supporting each other, ensuring that those elements are there to maintain that balance for wellness and self-care throughout, you know, what can be a stressful time. And I think our 2 residents who are on tonight, Teb and Asha, can attest to, you know, some of those fun challenges, particularly during COVID. So that's the one unique opportunity you have this interview season, is to explore how programs handled and adapted to the COVID environment. I think that's going to be an important marker for what is certainly going to be adaptation to come. So with that being said, Teb, Asha, do you guys have anything you want to add?
Sure, I'll just add that, am I unmuted? Yeah. Residencies tough wherever you go, but it's all about the relationships and the people. And when I went around the country interviewing at different places, I didn't make one of those lists of different like pros and cons. I just based it on a feeling. And when I went onto the campus, which unfortunately you guys won't be able to, but the feeling of family was just overwhelming when I went. And that's what made me choose it.
And it was very similar for me too. I picked it like mostly based on the vibe as well, but it was because like whenever I had my interview, I felt like the attendings who interviewed me like really cared about me as a person, and like the department chair person, he came by and he like introduced himself to all of us, and then all the residents, I could tell, like really cared about each other and were a family and supported each other, and that was like the thing that was most important to me, having residents that were like that.
Absolutely. I actually distinctly remember both of these interviews, but nonetheless, you know, very pleased to have them with us, as we are all of our residents. I think advocacy, which is what we all are, you know, oriented towards in pediatrics, is a really core value of the program. I always tell the applicants that advocacy is something that you do with every encounter in pediatrics, and that is definitely our culture. Thank you guys for joining us.
Awesome. Thank you so much. Next, we have Morehouse School of Medicine in Atlanta with Dr. Gardner.
Good evening again, everybody. I appreciate y'all's attention and the opportunity to be able to actually get a minute to speak with some of you that are in our room. So let me give you a little bit of information about Morehouse. We are really proud of our program. We are in Atlanta, and it's interesting because we're in a nice big city. So you have all the kind of bells and whistles of being in a larger city, but being a small program, I'm hoping it's a family feel. That's our goal. But I certainly do know all of our residents and of course, our team. But it's kind of nice because if you are looking for a small program, it kind of depends on what your bend is. But if you're looking for a small program, we're happy to invite you to come take a look at us this season. We have a really strong emphasis on the social determinants of health equity. Part of the mission of Morehouse School of Medicine is to decrease health equity, increase health equity, decrease disparities, and to really take care of children with an emphasis on taking care of them in the context in which they live. So kind of really understanding more than just on a surface level the other things that really affect children's care, that most of which takes place outside of the walls that we practice in. So we do have several of our rotations that are focused on this particular area to try to give more attention to that. And so just kind of knowing that those things are not just rotation specific, but also longitudinally woven in, as was just said. We speak about those things and try to work those into every patient encounter, which is, like I said, was just mentioned. So I'm following right behind. But like I said, we're a small program, lovely program. Our residents are beautiful, kind-hearted people who work hard and take really, really good care of the children that we serve. We are primary care focused, yes. But about 30% of our residents do go into subspecialties, and they, like for example, last year, one of our residents matched it at CHOP in behavioral development. We had someone else last year who, matched at Cincinnati, et cetera. So they do a really good job in residency and are definitely ready for subspecialty training should they choose it afterwards, but definitely ready for general pediatrics in whatever area of general pediatrics they choose. So we have the privilege of working in a large healthcare system, Children's Healthcare of Atlanta, very large healthcare system with all the subspecialties represented there as far as their ability to take care of families. So there's not a paucity of patients to take care of, which is awesome. And at the same time, we're also community focused. Lots of our subspecialty care takes place in the outpatient setting in private doctor's offices, especially for our residents who are going to be doing primary care. It gives them the opportunity to understand firsthand while they're training how you engage with subspecialists that are in private offices, which are going to be sort of the environments in which our residents are going to be training as they finish. So, but our residents do a beautiful job. We are proud of who we are. We're proud of the way we serve. We are proud of our families and the influence and impact that we can have on them. And so I'm going to turn it over real quickly also to my resident, Dr. Brianna Ferris, who's representing us tonight, to see if Dr. Ferris has any words before we close.
Thanks for the introduction, Dr. Gardner. It's a pleasure seeing everyone and being able to talk with you all tonight. I just want to emphasize that when you're looking at programs, the most important thing for me was having that family environment. And pediatrics is a warm field in general, but when I went to Morehouse, I knew that was my home. I'm very thankful and excited for all the experiences. At Scottish Rite, you may work with 5 different teams and consulting with just one patient. So you get a lot of subspecialty experience and a lot of experience outpatient as well. So I'm thankful to be here.
Thank you, ma'am. And I think that will be the sum of our presentation. So thank you all for joining us. Thank you for listening.
All right, next we have the University of Florida out of Jacksonville, Florida.
There you go. All right, so hi again, everyone. I'm really excited to be able to introduce you to our program. So we are a University of Florida program. We are a medium-sized program. We have our residents spend much of their inpatient time at the only area freestanding hospital, Wolfson Children's Hospital. You can see the logo up there. We serve basically most of Northeast Florida, Southeast Georgia, and extending all the way up to the Florida Panhandle. So it's really a very large area that we have where we draw our patients from. Our residents also spend time at our university hospital, which is basically the safety net hospital for the city of Jacksonville, as well as the surrounding 5-county area. So they get to see a wide variety of patients coming from every walk of life, refugees, immigrants, underserved. So the experience is pretty well-rounded because Wolfson has a slightly different patient population. So over the course of their 3 years of training, they really do get to see a lot. We are very proud of our 100% board pass rate over the past 3 years. We have really worked very, very hard on our curriculum and in assuring that our residents have the resources they need to be successful and to pass their boards. But, you know, that's obviously important, but at the same time, we make sure that they are doing so in an environment that is very resident-centric and, you know, where they feel that they are really cared for. Our program has a very strong emphasis on QI, patient safety, high-value care. We have plenty of opportunities for advocacy, involvement with the AAP through the section on pediatric trainees, through the Florida chapter, as several of our residents are liaisons to different sections, through the SOPT. And actually, 2 of our residents this year, we are very proud, got the Ann Dyson Award for advocacy through the AAP SOPT. And if any of you are joining the AAP NCE this weekend, then, you know, please look out for Isa and Marwa. They've done wonderful work with all the vaping advocacy work in our area. We have 100% fellowship matches and job placement. We are about 50-50. So 50% of our residents go into fellowship and 50% go into primary care. We have, just like, you know, many, many other programs that you've heard about, a very diverse and very versatile residents and faculty. Our residents alone speak at least a dozen languages between them. So we are a really, you know, fun group. They are a really fun group. And I think with them and our faculty, we represent really what America is all about, a real melting pot. There is a strong emphasis on personal and family wellness. Obviously, you have to look after yourself to take care of other people, and you have to look after your family. So we are very cognizant of that. And most important of all, you know, the place where we live. So Jacksonville it's a beautiful city. It's really one of those gems that is not so well known, outside of Florida. In fact, most people, when they come to interview and I ask them, do you know anything about Jacksonville? And they're like, yeah, we passed through it going to either Atlanta or Miami. So that's how most people know us. But it's a beautiful city, very affordable cost of living, lots of beaches, parks, sporting activities, lots of dog parks for animal lovers. Most of our residents have dogs, a couple have cats, a lot of them have kids, so lots and lots of fun things to do. We have a lot of information on our website, so I'd really like to encourage all of you to go to our website and look at all the different things that we offer. We have a dedicated advocacy track. We have a global health track with international rotation options in the third year in Colombia, South America, and also in China. And unfortunately, with COVID and whatnot, we'll see how things work out. But I'm really hopeful that we will get out of the situation we are in pretty soon. We are also adding a research track next year. So there's lots and lots of opportunities for advocacy, for scholarship, for almost anything that you want to do. And I have two of my awesome residents on, and I wanted to give them a chance to say whatever it is that they wanted to about the program. So Brett and Carla, if you want to say something, go ahead.
Hey, Carla, you're muted.
Sorry, forgot to unmute. Hi, everyone. My name is Carla. I'm one of the new interns at the University of Florida in Jacksonville. I'm really excited to be here today. And I just started my internship, but I have great things to say about our program. Aside from being a very tight program where people make you feel like really welcome, I really like the fact that we have like major collaborations in Jacksonville itself. We work with different hospitals and outpatient clinics, including Wolfson Children's Hospital with Dr. Miss just talked about, and our Nemours outpatient clinic with more than 30 specialties. So I think it's a great program where we can get like really good training and exposure to a lot of different attendings and different diseases, processes, and patient populations. I think it's a great place to come and learn and do your training.
So I echo exactly what Carla said. I think, and same with Teb, so you go and you want to see where you fit and where you feel like family. So that's a given, but a couple things that I was not aware of. So QI and advocacy are a large part of our program, which I needed a lot of help with. And when you go to try and get a job or you're going for fellowship, very often they focus on your QI projects and your research and what did you do. So this gives our residents a lot of opportunity to stand out from other residents, and we match into great fellowships. It also gives us experience that we can continue on a lot of different places, even outpatient focuses on QIs as well as research. Advocacy, it teaches you, just like our, you learn how to take care of the patient from outside the hospital as well, and that sticks with you the rest of your life. And the location is great, can't hurt to study on the beach.
Awesome. Thank you guys so much. All right, next we have MUSC out of Charleston with Dr. Mills.
All righty, I am ready. So I hope everybody's prepped and ready for me, because I've prepared a 30-minute speech. I'm going to be here a really long time. I'm just kidding. All right, I know COVID is the worst. I'm really sorry that you guys can't travel around the country for your interviews. But hey, bright kind of silver lining is, doesn't it feel good tonight to not have to wear a mask while we do this? I feel like the backs of my ears are more irritated than they've ever been before. But anyway, you've all made a really, really great decision in choosing peds as a career. I'll say it's so much fun on a daily basis, really opens up so many options for you in your career. So even though you can't go around and check out all these programs across the country, really try to enjoy this virtual process the very best you can. So a little bit about our program. So first off, I've been here at MUSC since 2005. I actually came down here from Cleveland, Ohio to start my residency. I left the cold weather behind and I've been here ever since. And I'm happy to be here in the warmth down in the South. I really hope it comes through as I talk to you tonight, but I absolutely love our program and the people in it. And I love Charleston as a city. I'll be honest, when I started my residency back in 2005, I had no idea that I was going to be the program director, 15 years later. So it's been really cool to experience that myself. At FUSC, we offer 2 specific pediatric residency programs. So our categorical peds residency has 14 residents per year, and we have a smaller primary care program with 2 residents per year. You can apply to both of them if you're interested. And our primary care residency program is absolutely awesome. You can hear more information about that specifically at our upcoming ComCep open house. Today, since it's a larger program, I'm going to give you highlights about our categorical program. So we're a medium-sized program. We have 14 residents per year. This number that you see, 66 on this slide, includes our primary care program, med peds, and child neuro residency, but categorical is 14 per year. Massive referral center. We're super lucky that we have ped subspecialists in almost every subspecialty imaginable. And as some of the other programs have mentioned, about half of our residents go into outpatient peds when they finish, and half go into fellowships. And truly at some of the best programs in the country. I'm really proud of that split because it really does show a lot of the great opportunities that we provide. So just a few program highlights. We have a couple of optional dedicated tracks that you can sign up for, specifically global health, doing an international elective at multiple sites around the world, hopefully, fingers crossed, once COVID is past us. And for medical education, we actually have a special medical education track for people who are more interested in careers in academics and teaching. We have a really robust advocacy curriculum that continues to grow. It really gets residents out into the community and offers them learning opportunities at local, statewide, national levels. And we've really placed an emphasis on diversity here in our program. We've worked with our pediatric department's diversity committee to really enhance the diversity of our resident trainees. And we're proud to say that 38% of our intern class actually identify as underrepresented minorities. Wellness, super important. It's important to everybody out there. It's really important to us as well. And we have a great wellness curriculum that continues to grow also. The best part about our program, and I know everybody says this, and I'm sure it's true everywhere in pediatrics, but we're so proud of our residents. They're really the lifeblood of our program. They have a really important voice. We're really proud to make changes all the time based on their input. Just as one example, we actually recently transitioned to a night float system for all of our interns on the wards. And this was really based on resident feedback and suggestions. So we listened and we said, all right, we're gonna make it happen. And I have to tell you a couple other things. So one of them is we just built and moved into a gorgeous new children's hospital that just opened this past year. It's called the Sean Jenkins Children's Hospital. It's really state of the art. It's right downtown, offers gorgeous views of the Charleston Peninsula. And honestly, it's been a great upgrade on a lot of levels, but it's been fun for us as providers because you can go outside, you can sit on these Adirondack chairs on like the 8th floor of the hospital, eat your lunch and just kind of relax for a few minutes. So it's really, really good to decompress. And then if you haven't been to Charleston before, it is really a fantastic city. We're surrounded by beaches in multiple directions. I've learned how to surf, how to kayak, how to paddleboard, which for a guy coming from Cleveland, Ohio, that was not something that I had expected. And again, I'm bummed that you won't be able to come to visit us in person, but hopefully you'll consider checking us out. So as I mentioned, I've got a couple of really wonderful residents here with me, Zig and Charlene. So feel free, either of you, if you have any comments to make, the floor is yours. Thanks, everybody.
Yeah, I'm Charlene. I'm a second-year resident at MUSC, and really quick, I just wanted to say when I was making my list, I just like to hear what other residents, what made them choose their programs on their rank list. And for me, I just chose like the 3 top things that were most important to me is that a program had to have a global health track, which we do, and I'm in that track, which has been an incredible experience for my residency education. I wanted to live in a really cool town where there would be fun things to do when I was off work because we don't get off that often. So when we do, I want to have a good day. I want to be able to go to the beach and go downtown and to all the parks and fun things that we have in Charleston. And then the third thing was I just wanted a really wonderful, supportive environment with the fellow residents and with the faculty, and we definitely have that here. So just choose a couple of things that are the most important, you know, top priorities for you in a program, and I would say make your list based on that. But no matter what, you're going into the best field in the entire world, so you're going to end up in a good place. So good luck to you all.
All right, thank you. And lastly, we have Emory University with our program director, Dr. Booker.
Thanks, Amelia. This is going to be a team presentation since my group is here, and I'll start. We have 82 residents, and that's 25 categorical, 3 child neurology, and 1 medical genetics pediatrics position. Our residents work out of not 1, not 2, but 3 children's hospitals that are operated by Children's Healthcare of Atlanta, as well as the Safety Net Hospital for Atlanta, Grady Memorial Hospital. I'd like to highlight our longitudinal diversity committee that our resident diversity committee has implemented this year. We have done implicit bias training and upstander training for all of our residents in July, and are now having health equity rounds and diversity journal club as well. Emory as an institution offers graduate medical education tracks. There are about 10 of them in a variety of disciplines that you can see on our slide. They do include med ed, which I know there was a question about. These tracks involve monthly didactic curriculum and culminate in a project that can be done by the residents, and they end up with an area of distinction. In addition, we do have a global health track specific to our program that you'll hear about. We pride ourselves on mentoring each individual resident towards their individual career path, and the program directors serve as first-year mentors to all the intern class. I'll turn it over to Rebecca.
Hi guys, I'm Rebecca Sanders. I'm one of the APDs, and I just want to tell you that Emory is a great place because you will get to see just the whole spectrum of pediatric disease within a backdrop of a really culturally diverse patient population. And you get to see a lot of very rare cases because we do live and operate in such a big city. But you also get great foundation in those bread and butter pediatric conditions that give you that strong foundation in general peds. And we have over 500 faculty in the Department of Pediatrics at Emory. And that really means that whatever your interest is, whatever you want to do for research or clinically, we have someone here who can support and mentor you. And, you know, that is a big goal of ours, is to help you reach whatever your career goal is. If it is subspecialties, our support has resulted in really excellent fellowship matches, and we continue to send residents all over the country, and when we're really lucky, get them to stay at Emory for fellowship. Part of that is research, and I'm going to let Dr. Wolf, one of my colleagues, tell you a little more about that.
Hi, I'm David Wolf. I am one of the other associate program directors at Emory, and I'm a child neurologist. And as Dr. Sanders said, we have a very large faculty, and they are very active in research. We're number 3 in the country for NIH funding among pediatric departments. So we have an excellent research infrastructure in place, and our residents really take advantage of it. A number of our residents do research electives that result in posters and publications in various journals and go to national conferences. They do work in quality improvement, advocacy, health equity, case studies, prospective studies, retrospective studies, and work in clinical trials. And starting this year, we have a new program in place called the Pediatric Research Investigative Scholars at Emory, a personalized research track for residents interested in research. And highlights of it are a personalized mentoring concierge service where we really find what your interest is in research and find the person among the faculty who can help you guide that research. And then lectures on how to get a grant, how to write an abstract, how to think about publication. So we're very excited about the opportunities that you'll have if you choose to join us at Emory.
All right, I guess I will kind of speak a little bit to this because we have about maybe 30 seconds for me to say. I want to echo everything that the residents were saying as well. One of the things that I did as an applicant, I had one person that I called after every interview, which I didn't realize I was doing. It was my mom. And she, at the end, when I was making my rank list, was like, oh, you said maybe the same thing about most of these programs, but there were ones that I could hear in your voice that you lit up after you came from it. So if you have one of those people, if it's your mom, if it's your best friend, your significant other, whoever it is, make sure that it's someone that you have like a consistent person that you speak to, because I know I tried to do that whole entire Excel spreadsheet thing and it kind of didn't end up working for me. But having that like initial reaction at the end of the interview day was really helpful for me when I made that rank list. So moving from that, I think next we're going to go ahead and answer some questions. I think there were about maybe 5-ish or 6-ish questions that the moderators put up on our little list. We have about 12 minutes left, so all the residents that are in the group, you can go ahead and answer that. Any program directors that want to answer this question, the questions that are posed can also answer them as well. So the first of which, I think Brett Murray has a couple questions up there on this list. If you want to read them out, Brett.
Yep. So the first one is for the IMG graduates. They had any recommendations or advice you could give for them? I know we have a lot of IMG grads at our program.
I guess I can jump in here. So I think I may be the only IMG program director in Florida. So obviously I have some experience with this, and we do welcome, you know, our program is a healthy mix of AMGs, DOs, IMGs, and I think that makes our program all the more richer. There is a webinar that we are doing on Monday which is specifically geared towards IMGs. So I would encourage those of you who are IMGs to see if you can attend that, and maybe some of your questions could be answered there, because this is such a broad question that I can probably spend half a day talking to you about this. But like everything else, I mean, you know, put your best foot forward and let people know who you are and where you have trained, because you know, again, you know, especially if you are an international IMG, people may not be very familiar with your med school, and especially the way our transcripts and LORs look. They're very different, and it's very hard to interpret them, especially for people here. So you know, see if you can attend the webinar. I think you might have some of your questions answered more specifically there.
Thank you so much, Dr. Mears. Anyone else who has any advice or?
Yeah, I think it's a little extra important for you guys to figure out how to connect your story to what you want to do next. I think for most program directors, that's the important piece, is ensuring that there is a genuine interest and desire in pediatrics. You know, we are more holistic than most fields. Most programs do take a more holistic approach to evaluating our candidates. So it is just important for us to understand, you know, that your commitment to the field is real. And then of course, I don't have the specific experience Dr. Mirza has. I'm sure that any advice she gives in terms of resources are available would be invaluable, but I think that's an important piece, at least for me, with a large pool of applicants, to have some connection that allows me to really feel the genuine commitment to the field.
And it looks like Brett has a couple more questions that you can go ahead and read out.
All right, so there's two that are kind of connected, and And then one specifically asks, without a significant tie to the area, is it likely to get into the Southeast? And then the follow-up question from someone else was, what are some best ways to display interest to programs when you live far away but do have family nearby to the program? So tying those questions together, obviously if you do have family nearby, or you're from the area, or you're interested in staying in the area to do fellowship or practice, things like that, that always, just like Michelle was saying, if you can have some type of tie to your story, I think that serves more than if you're in a location. From a medical student trying to apply to different residencies, I specifically focused in areas, one, where I had experience because I knew some areas, some hospitals, networks, and two, where I wanted to be, because you tend to, I think the majority of I don't remember the statistic, but the majority of people who attended residency in a specific location actually ended up practicing there for the first 5 years after they graduated from fellowship or residency. So it is really something important to think about. I think it is also a big advantage as well, because you do learn the resources when you're there, and that can be an invaluable tool.
Yeah, we
just add there too. This is Dr. Gardner from Morehouse. I think if you are able to communicate with the programs why you're interested in a particular area, whether or not you have family or connections there, it probably wouldn't be as, question mark as you're thinking, because, you may have a very legitimate reason. I mean, you just may like the school, or you just may like the city, or you may have another reason that you want to be there. So I think just clearly communicating that would be fine. And then also keep in mind that when it comes to diversity, there's also the element of diversity of geography, where you come from, different mindsets from where you're going. So it's actually I look at it as a very positive attribute. If there's someone who is from a different place who wants to come to our program, I see that as a positive. It actually adds to diversity a different dimension.
This is, Texas again. We often get the question in Texas, there's so many programs in Texas. Do you guys even think about, there's so many medical schools, there's so many students. Do you guys even look outside of the state? And we definitely do. And for that same reason, as Dr. Gardner referred to, we want to make sure that we're, enriching our community. One of my residents, Asha, is actually somebody who's has ties to Texas, but also did go to school out of state, far up on the East Coast. So, I think she might have some insight into this, but for sure, I think, again, just some way to communicate either in your personal statement or with the program coordinator or the residency program point of contact, that you do have a genuine interest is a helpful bit. But it can be a program you're interested, it can be a population you're interested in, it can be a type of community you're interested in. All those things are definitely part of our interest in reviewing applicants.
Yes, we always look for residents from different places. We like to fill in our map. Right now we have, I think, 23 different states represented amongst our residents, and we're still looking for somebody from South Dakota or North Dakota.
They may be the only state that doesn't leave their state more than Texans.
Yeah, and I just like to sort of tie in with what was already said, is look for if there's something specific you're interested in. One of our residents actually came to us from all across the country, from Utah, and because he's interested not just in global health, but very specifically in China. And we have ties with Beijing Children's Hospital. So, you may find your little niche somewhere in some particular program, and don't be afraid to, express that interest, because I think that's helpful all the way around for the program as well as obviously for yourself.
Awesome. Thank you. I think Brianna Ferris also has a couple of questions that she had posted, one of the resident moderators.
Yes. So another question that was asked is, does each of your programs have curriculum that is focused towards diversity and inclusion? And I could say from my experience at Morehouse, diversity and inclusion is really included in everything that we do. From even at Scottish Rite, when you have all of your different patients, you see so many patients with different backgrounds. We work very closely with social work, especially at when you're at the Children's Hospital at Hugh Spalding. So we have a lot of a diverse patient population, and a lot of our curriculum also discusses inclusion. We have LGBTQ discussions, and we've also had morning report on different topics. We've even talked about like the beginnings of healthcare in Egypt. So we have a very diverse program, and also with our lectures and didactics and even our patient experiences. Being in Atlanta is a great opportunity to have that diversity.
Yeah, I echo what Brianna just said. Definitely a really important aspect of our training, and it's something that we're really proud of. We have a diversity director within our pediatrics department who's one of our faculty members, and we have a diversity committee that a lot of residents serve on as well. And I think it's a really important thing to try to incorporate that as frequently as possible in the ways that we educate and the experiences that we provide for residents. So that's something that we try to build in at every level, getting out of the community, providing medical care for those who are underserved in a lot of areas or have no insurance whatsoever. And that's something that, I think is a really important emphasis at every program, but it's something that we are certainly proud to provide at MUSC as well.
I think we're about to get pulled back. Thank you guys for attending.
Yeah.
Thanks,
think
everybody.
the PDs end up leaving now.
Yeah.
Right?
Bye,
Okay.
Amelia.
Bye. Thanks for coming.
Bye, Kira.
Thank you,
Thank you,
Dr.
guys. Had fun.
Terrace. Thank you, ma'am.
Bye. See you later.
Bye.
So we still chill in this room, right? Or no? Do they pull us into the main room?
It
I
says
think
that we're
they'll
all
pull
pulled
us
back
into the main room.
Yeah.
Yeah, we can go back to the main room now.
You want to go back now? Okay. All right.
Wait, how do we do that?
And they'll
Press
redistribute
the
us for
button
the
that
after
says
hours.
like leave breakout room.
I'll just wait for it to, I don't know where it went.
Yeah, in 50 seconds if you don't